Hello, my name is Michaela Friedeck. I am P4 pharmacy student from Drake University College of Pharmacy and Health Sciences. Today I will be talking about melatonin and its alternative uses. An overview of what I'll be discussing. First, I'll go over the background of melatonin. Then I'll go into alternative uses of melatonin and wrap up with some final thoughts. Melatonin is a hormone that is synthesized in the pineal gland located within the brain. The primary role of melatonin is regulation, so it regulates the circadian rhythm, the endocrine system, and sleep patterns. Melatonin is commonly used for sleep disorders, so things like insomnia, delayed sleep phase syndrome, and non-24-hour sleep-wake disorder. It's recommended in doses such as 3 to 5 milligrams once daily at night for these disorders. However, we often see it up to 10 milligrams daily. The three disorders I will be talking about today are diabetes, delirium, and cancer. These are the three alternative uses I'll be discussing for melatonin. So first, diabetes. Melatonin has been used for diabetic neuropathy pain, and diabetic neuropathy pain is one of the most common complications of diabetes. Melatonin has antioxidant properties, meaning that it promotes expression of the antioxidant enzymes within the body as well as the inflammation-related genes within the body. This causes protection of the nerves. It also has anti-nociceptive properties, which means that it blocks detection of painful stimuli from the nerves, which leads to pain. Within studies, they often use melatonin in adjunctive therapy with other types of drugs to help cure or help people with diabetic neuropathy pain, such as Lyrica or pregabalin. Second is delirium. Delirium is a life-threatening syndrome which manifests as temporary mental disorder. It occurs in up to 20% of ICU patients, and it commonly occurs in hospital stays, in older age populations, and people that are post-operation. And so melatonin use in delirium, we see reduced incidence of delirium in hospital admissions. So melatonin given prophylactically in one study at a low dose of 3 milligrams after acute heart failure saw a decreased incidence in delirium. There was improved sleep, which correlated with shortened length of stay and decreased expenses. The last and third disorder or disease is cancer. And so melatonin has been seen to improve tumor regression and survival rates in combination with other chemotherapy or other cancer treatments. Examples are breast cancer and pancreatic cancer, but melatonin has been seen to be beneficial in many other cancers as well. Specifically in breast cancer, melatonin has selectively neutralized estrogen's effect on breast tissue. And in pancreatic cancer, it inhibits vascular endothelial growth factor, mRNA expression in pancreatic cancer cells. In cancer, it's important to note that melatonin is used at very high dosages. So my final thoughts, overall, it is a very safe and effective drug. However, the most common adverse effect is going to be the drowsiness, which is pretty common since we use it for sleep often. And then the third thing is if we are using it for these various disease states, Is it gonna become prescription or stay over the counter? I guess it just depends on the risk and benefit of taking it at what dosages and whatnot. It's just something interesting to pay attention to. And lastly, there's a lot more research that has to go into it, especially as we look into various disease states that melatonin can play a part in. And that is all that I have today. These are my resources if you would like to look into them further, and I appreciate your time. Thank you.